For 1 month, National Recovery Month puts treatment top of mind for the public, and most centers let it pass by. Every September, more people search for addiction treatment than usual. Miss it, and you miss a year's worth of momentum. National Recovery Month is not just a holiday. It is your best chance all year to promote your center and connect with your local recovery community. We will walk through 4 critical steps you can take today. Make a plan, know your hashtags, run a promotion, and celebrate your referral partners. So, what is National Recovery Month exactly? SAMHSA created National Recovery Month in 1989 to promote evidence-based recovery and treatment and celebrate the recovery community across the United States. It happens every September. For the general public, treatment moves to the top of mind, which means more people are looking for help than usual. For your center, it is not just a holiday. It is an opening to promote your business and reach the people who refer patients to you. Here's the catch. Without a plan going in, your efforts to bank on National Recovery Month simply will not go well. The buzz around recovery lasts weeks, not months. With no goals and no messaging ready, the moment passes before you act. And careless referral outreach carries its own risk. Gestures that look like bribery can run you afoul of anti-kickback laws. So let us turn the month into momentum. 4 critical steps, starting today. Each one is simple. Together, they make September work for your center. Step 1. Make a plan. A content calendar. Decide ahead of time what your goals are, what message gets you there, where you will share it, and who you are speaking to. Target potential patients, their family and friends, referral partners, and alumni. Each audience needs its own message to truly land. Step 2. Know your hashtags. Social posts have limited reach without them. SAMHSA's official hashtags are Recovery Month, Recovery is Possible, and Recovery Journey. Use them to widen your audience. Always add a local hashtag. If you are in Florida, tag Florida. There is no point reaching thousands of people who will never become patients. Step 3. Run a promotion to boost admissions. Try a free workshop, a free consultation, a 10% off coupon, or a gift card contest. Pick the best fit for your market. Tying the promotion to National Recovery Month gives it a sense of urgency and timeliness it would not have on its own. Step 4. Celebrate your referral partners, where most of your patients come from. Community organizations, social workers, medical professionals, and clergy point people toward recovery. You want to be on their radar. Reach out with emails, thank you cards, or nominal branded tokens. Keep it a genuine gesture, never anything mistaken for a kickback. Most of your patients come from referral partners, so the system that tracks those relationships matters. Behave Health's all-in-one app brings admissions, alumni, and residents together. Designed to support the outreach National Recovery Month is built for. Clinical, administration, billing, and insurance authorizations live in the same place. Designed to help your team follow up without losing the thread. Put it together, and 1 month of work pays off all year. Plan ahead with a content calendar tuned to each audience. Post with SAMHSA's hashtags plus your local tag. Run a timely promotion to lift admissions. And thank the referral partners who send you patients. Stop letting National Recovery Month pass your center by. See the all-in-one app that supports admissions, alumni, and referrals. Book a demo at behavehealth.com. Start a free trial and see clinical, admissions, billing, and alumni in one place. Book a demo at behavehealth.com.